Two patients walk into your clinic with same complaint. For example, low back pain. So one patient needs strengthening exercise, another needs maybe nerve mobilization and movement retraining. So you as a physiotherapist, how are you going to decide which patient needs what? So that is called clinical decision making. Hello everyone, I am Aishwarya, a physiotherapist. Welcome to this channel. So today we'll be talking about clinical decision making. Clinical decision making is a structured thinking process where you assess, analyze, and also come up with a decision of what you're going to give a treatment protocol to a particular patient. It is a combination of three factors. First one is the scientific evidence, second is the experience of a physiotherapist, third, patient specific factors. It involves few steps. So the first step is subjective assessment, where you actually try to understand the patient's story. So the story is like what could be the pain. So you ask many questions to find out what exactly the patient is going through, and then you come up with some kind of understanding of what exactly is the problem of the patient. This particular step helps us try to understand and identify few causes, few red flags, and few functional limitations. So this is the first step where you actually try to understand and try to clinically decide what is wrong. Next comes the objective assessment, which is step 2, where you as a physiotherapist would definitely be learning in your college, which could be assessing of range of motion, could be strength, could be neurological assessment, could be some special test in case of MSK and sports. This helps us identify the true source of the problem. The important step next is the clinical reasoning. Here in this step, the physiotherapists try to connect the dots. You combine the physical examination, you combine the patient history, and also you try to combine the scientific evidence or the recent evidences that are there in this particular patient, and then try to combine and form a working diagnosis. Once we diagnose a particular problem, then we come up with a targeted rehabilitation plan based on the patient's goals, based on the patient's requirements. We plan a systematic rehabilitation protocol where it gets benefited to the patient, and it depends from person to person or patient to patient. It could include exercises, it could be manual therapy, it could be functional training, task specific training. There's a list. So it changes from patient, so you cannot say which patient needs which therapy without assessing. Clinical decision making does not stop at this. So the next important is the reassessment. So after probably 2 or 3 sessions, you find out that there's something different and there's something that I'm seeing which I have not seen in my initial assessment. So you reassess to find out if there is any other problem or any particular point that you're missing out. So you reassess and then again analyze, and then this would be another step of clinical decision making, where you find out initially you start with the hypothesis where you're thinking that this could be this could be the problem, but then later on when you assess and reassess, you will come up with a final conclusion and final diagnosis, which is very helpful for you to plan a rehabilitation protocol. So young physiotherapists should understand that physiotherapy is not just about giving exercises, but it's also about clinical decision making. It's also about thinking, analyzing, scientific clinical reasoning, and also planning of the rehabilitation. So all the process of this is called clinical decision making, which will help you become a better diagnostic person, better physiotherapist. If you all felt that you learned something, please do like, share, and subscribe to this channel. Hope you had a great learning. I'll see you all next time. Bye.